Hey everyone, welcome to our EMTprep skill video on how to pass the oral station. We wanted to create this video so that you have something to reference when you're going into your exam and also give you an idea for a template you can build to take in with you, or at least take in the knowledge of the template with you to the skill station when it's time to take your test. A lot of times we hear from students that their proctor during the skill exam was too strict. They asked questions that weren't in their scope, or maybe they just were caught off guard by one of the questions and didn't know really how to recover. So it's pretty important, and we think it's worth reviewing how to do this skill and do it properly. So this is a template that we've created, as you can see below, and it is pretty simple. However, it contains all the information that you need to ask during most medical calls that you're going to be presented with during this skill station. You'll notice there's a lot of acronyms in it: vomit, sample, ABC, and OPQRST. The reasons that they're in there are to provide you with a reminder to ask each portion of that acronym during the skill station itself. So vomit stands for vitals, oxygen, monitor, IV, and transport. So let's say, for example, you got a set of vital signs and you wanted to write down the concerning ones. So you had a blood pressure of 88/40 and a heart rate of, let's say, 50, just for the purposes of this video. So that would be something you'd write down there. For oxygen, you want to make sure you write down the room air sat and then put a little arrow next to it that shows after oxygen administration. So let's say you put a non-rebreather mask, you got the patient up to 98%. M is just to remind you to put the patient on the monitor, and if you find anything concerning, write down their ECG. Ensure that you do an IV of some sort. If it's a trauma patient, you're going to want to do multiple IVs, large bore, and then you're going to want to add your transport decision, code 1, code 3, etc. For sample, remember this is signs, symptoms, allergies, medications, past medical history, last oral intake, and the events leading up to the illness. Just go through and ask these questions like you normally would, and gather any feedback, anything that's concerning. You would write that down in this area here. ABC is obviously probably the most easy one to remember: airway, breathing, and circulation. However, make sure that you write down all the findings. So you want to write down a patent airway, or one that's going to need some sort of management. Write down the lung sounds as you hear them, as you auscultate them, and also write down the patient's pulse and their skin tone and skin color. And then the last one is OPQRST, and this is probably the one acronym in EMS education that throws students for a loop. Not all the time, but some people just have a hard time remembering a few of the questions regarding each step of the process. So O is onset, and you're going to ask, what were you doing when the pain or event started? P is provocation. Does anything make the pain better or worse? Q is quality. Can you describe the pain for me? R is radiation. Show me where it hurts the most, and then ask, does your pain go anywhere from that point? S is for severity. You're going to ask the patient to rate the pain on a scale of 0 to 10. Remember, pain is subjective. And T is for time. How long ago did the event or pain start? And again, you're going to write down any information that is concerning or that you want to keep in mind right there on that little section next to the OPQRST acronym. So you might be asking, okay, well, what's the stick figure in the middle of the page for? Well, it's to remember to do a head-to-toe body check. So remember to go straight head to toe, and you're going to write down any findings during your exam. So let's say you had a bleeding scalp wound. Well, you might highlight that area and make a little note. Again, that's just to remind you what's going on there. Once you get to the bottom of the feet, it's totally acceptable within your skill station to say, I have found these 3 problems during my head-to-toe exam. I'm examining the patient one last time. Is there anything that I've missed as I look them over? So lastly, use this bottom third of the template here to write down interventions that you've performed and notes that you want to remind yourself of as you go along and do your skill station. If you do these things and remember to ask all these questions and write down these notes and treat accordingly, it's harder to fail this skill station than it is to pass it. Hope this video has helped. If you guys have any questions, feel free to send us an email or put a comment in on the YouTube box below.